Hi everyone. We have a presentation for benzene poisoning and we have prepared it. Here are three students, Hamas, me, Kamar and me. Hamas have to start the presentation. We will explain the first 5 questions and then Kamar will come for the next 5 questions and then at the end I will finish with the 4 questions. So I request Kamar to come to stage and start.
So, benzene intoxication and hydrogen sulfide, it is the most common intoxication that a person or a worker should in the industrial area, because there are many chemicals that emit such gases like benzene, hydrogen sulfide, and many other poisonous chemicals that will go indirectly in our body or directly through inhalation, skin absorption, contact, and many other ways, and it will slowly deteriorate your health and make you sick, and at the end of at the last stage the person will die. So benzene toxicity, as I was saying, goodbye to your immune system. Why? I get to explain first 5 questions, so I will start with this question. What is a common poison that will lead to the aplastic anemia? What are the main exposure routes? Aplastic anemia. Anemia, what is anemia? It is the abnormal amount of red blood cells. Benzene fumes are the common poison that will lead to aplastic anemia. The main exposure routes includes mainly inhalation. About 50% of the benzene is accumulated in our body through the inhalation, while other low ways are skin, contact, absorption, and ingestion. While we may eat food that contain benzene or touch sources that contain benzene, these are the ways that benzene can enter our body. What other investigation should be made to determine that it is occupational disease? Occupational disease, as one knows that it is the disease caused due to the worker working in a certain specific environment, and that environment contains these toxic chemicals. So, what makes it the occupational poisoning? As she, the worker Miss Shaw, works in a shoe making factory, so the products used there are mainly glue, rubber, paint, nylon, and plastics. All these emits benzene fume, that is called the benzene poisoning. So, it is occupational poisoning. As we discussed in the case, Mrs. Shaw works in a shoe factory. So, there are many chemicals like glues, nylon, these all emit benzene fumes, so she gets that occupational disease due to benzene fumes. What is the diagnostic basis for chronic benzene poisoning? Chronic exposure to low concentration of benzene may cause blood forming suppression due to effect of phenol on bone marrow. It may have to affect nerve system and hematopoietic system. As person inhales the benzene fumes, it not only just cause effect on our hematopoietic blood system, but it also cause effect on our nerve system. But if it is in low concentration, at high concentration it may cause acute disease. But in low concentration it may develop into chronic disease. Compare the clinical manifestation of acute and chronic benzene poisoning. The acute and chronic poisoning are as follows. Acute, as person ingest or inhale large quantities, it may cause acute poisoning. Acute poisoning include transporting effects of nervous system, headache, drowsiness, dizziness, nausea, and staggering gait as a feeling of drunkenness. While chronic, it has a major effect on two systems: nervous system, neurosymptomatic syndrome, and hematopoietic leukopenia, thrombocytopenia, anemia, pancytopenia, and leukemia. What is this leukemia? Leukopenia is the low concentration or low amount of white blood cells in the body. Thrombocytopenia, it is a thrombus causing agent, low but in low concentration. Pancytopenia, it is all the cells, if they are in low concentration, that it is pancytopenia. Anemia and leukemia, as all as noted. So acute cause directly affect our nervous system, but chronic may lead to hematopoietic system or blood system infection. What are the reasons for the patient getting chronic benzene poisoning? The patient was working in the factory for a long period of time and her office is in the storehouse, so she has a close contact history with the benzene. The concentration of benzene in air ranges from 120 mg per meter cube to 360 mg per meter cube, which is 20 to 60 times higher than normal concentration. So that is why long exposure to benzene led to chronic benzene poisoning. And so, as it is mentioned in the case, so we can know that her contact with the benzene is very normal than the normal person. So that's why she got chronic benzene poisoning. And for the next 5% comment.
And I will tell you first of all, occupational health surveillance should be carried out. I mean, workers exposed to benzene, mean जो हमारे पास benzene से expose हो सकते हैं. Occupational health services should be include उनका mean ventilation, breathing, उनका breathing rate increase किया जाए. हाँ sorry. Less harmful substitute, technical procedure innovation, ventilation and personal protections. Mean when they workers inhale lot of benzene, it's mainly affect the lungs. In that case, decrease the perfusion rate. In order to increase their perfusion rate, we put them on ventilation. Ventilation will increase breathing rate, and they will try to compensate the increased level of benzene in the body. And okay, first see videos, then we will talk about that thing, what is going on. Okay, benzene basically colorless, flammable. We can flammable mean we can burn, and liquid with a sweet odor, sweet smell. Okay, it evaporates quickly when exposed to air. Being when come in contact with the air, it evaporates in the form of bubbles in the air. And benzene is formed from natural processes. Okay. Question number 1 from hydrogen sulfide poisoning. Basically, as there with H2S present in the tank in low concentration, it is highly toxic and may cause death in a few seconds. Basically, in case of hydrogen sulfide poisoning, when the workers inhales hydrogen sulfide in their lungs will collapse, and due to insufficient breathing or less amount of oxygen they inhale in the body, lead to suffocation and such things like death occurs. Okay, what are the common occupational toxicants cause sudden death? Carbon monoxide, hydrogen sulfide, hydrogen cyanide. Basically, in our blood, there are RBCs. RBCs has hemoglobin. Hemoglobin has more affinity for carbon monoxide. Carbon monoxide strongly bind with hemoglobin, part of the red blood cell. When the carbon dioxide binds with the hemoglobin, it does not dissociate easily. For example,
fluoride. For the sudden death, fluoride. Not carbon monoxide.
okay.
Carbon monoxide cannot cause sudden death, but fluorine can.
This is hemoglobin part when this one like this bind this one. We know about that when we inhale outside from like irritant gas, it directly binds with RBC's hemoglobin, and when the bond between hemoglobin and hydrogen sulfide, it is more stronger. When in order to think about this, when hydrogen sulfide binds with hemoglobin, it will not easily replace with oxygen. When it will not replace with oxygen, it will lead to strong bonding with this hemoglobin, and it's
Carbon monoxide back to
okay. Basically, it lead to collapsing of the lungs. Due to collapse, it lead to not enough worker to inhale. sufficient ventilation, and due to less sufficient ventilation, it lead to collapse and lead to death. Okay, what are the most common poisons in storage tank of wallpaper, worker of other accommodation like this? Hydrogen, methane, hydrogen sulfide. We know how methane in house purposes we use gases, and the gases is important to involve in pulp and paper industry able to precipitate the risk. In this case, in this question, trying to tell us that common poisoning in storage tank pulp mill like hydrogen, methane, hydrogen sulfide, and like these are the combustible gases. Combustible gases mean we can burn, and so that's why it's very important in pulp and paper mill industry. And like in other sense, due to bacterial activity, bacterial action like aerobic or anaerobic reactions that happens due to these due to these gases. And if there are some people lost consciousness continuous in working place, what are the emergency? Yes, mean for example, a sudden attack, inhaling lot of hydrogen sulfide gases in the body, but how we can treat or how we can give emergency medication to that patient. Worker, we inhaled lot of hydrogen sulfide. Basically, in response to that condition, we should immediate removal of victim from source of protective rescue. It means that where he worked, we inhaled lot of that type of gas. We should immediately remove that victim from that place in order to not inhaling lot of that gas into the body. Second, placing patient in the fresh air. When we will put that worker in the fresh air, he will inhale lot of oxygen. More ventilation, more breathing in a minute in order to increase the ventilation. This is the process of ventilation. And maximal supportive theory, nitrates. Nitrates are very important because nitrates, we studied in pharmacology, nitrates are the vasodilators. When we take nitrates in the body, it converts into nitrites, and nitrates act on the bronchial muscles in order to dilate the bronchial muscles. When the bronchial muscle dilate, we can excessively or sufficient amount of we can take oxygen into the body in order to reduce the frequency of that hydrogen sulfide gas. And also hyperbaric oxygen. Hyperbaric oxygen is that level where high. It is a type of chamber in hospital where there is a sufficient amount of oxygen put mask on the patient, inhale lot of oxygen into the body in order to reduce the hydrogen sulfide poisoning.
I'm here to explain the last 4 questions. First, we are going to read the question. Summarize physical and chemical properties of hydrogen sulfide, the clinical manifestations of hydrogen sulfide poisoning and its poisoning mechanism. Here there are 2 parts of this question. The first part we have to describe its chemical and physical properties, and the second part we have to show its mechanism. Let me tell you about its physical properties. Its physical properties can smell like typical rotten egg udder. Do you know? Let me tell you it in Urdu. Sada hua anda. Right? So it smells like rotten egg udder. And let me tell you one thing more here. Do you know LPG gas have no smell on its own? And they are carrying ethyl mercaptan for the purpose if there is any leakage, and we have to understand about it, and we know about it that there is some leakage for the udder, for the smell they add ethyl mercaptan. So that also contains ethyl, and it smells like rotten egg udder. The second physical property of it is flammable. It takes fire when it is okay. And the third property of it is colorless gas. Most of the gases are all colorless. And its chemical properties is first property is it is water soluble. And secondly, it is soluble in organic solvents like alcohol, ether, etc. And it's another property of corroding the metals. It comes in contact with the metals like corrode the metals. Okay. We have to describe its chemical manifestations. So let me tell you, bluish purple color of the skin and mucosa, hyperacute may cause anorexia, dyspepsia, and convulsions and death. Acute poisoning may cause coma, respiratory distress, pulmonary edema, tachycardia, and chronic spasm. I think you are all doctors and you know about all of these diseases, so I think I don't need to explain about all the diseases.
We don't know.
Let's come to our next topic, poisoning mechanism. Kamar already explained some of the mechanism here. Let me tell you again, hydrogen sulfide reduces protein at disulfide bonds, so it decreases the binding capacity of hemoglobin, myoglobin, and cytochrome oxidases. When there is no oxygen with the hemoglobin, its color changes. Do you know about this?
Yes.
Let's see in the picture the fingers, fingertips, and here face. All things you can see. The lips, it's like bluish. Why? Because there is deficiency of
Oxygen.
oxygen. Okay. Because the hydrogen sulfide reduce the ability to bind with the oxygen. Let's move on. First read the question. Please list the name of some irritant gases and different solubilities in water. List the name of simple and chemical asphyxiating gases. First we have to discuss about the irritant gases and its solubility order. Okay, some are more soluble in water, some are less soluble in water, and some are not soluble in water. The first highly soluble in water are ammonia, ammonium hydroxide, acid gases like hydrogen chloride, hydrogen fluoride, and hydrogen iodide. These are highly soluble in water. Slightly soluble in water are halogens. Halogens, you know about helium, neon, argon, peptides, xenon, radon, and ozone is O3. So they are less soluble in the water. And insoluble in the water are nitrogen dioxide and COCl2. Okay. Do you know about asphyxiation? What is asphyxiation? What? How can you say it in Urdu? Yes, it is a state in which there is a deficiency of oxygen. In Urdu, we call it dam ghutna, right? We call it dam ghutna in Urdu. So, which gases cause the asphyxiation? So, they are carbon monoxide, hydrogen cyanide, and the third one is hydrogen disulfide, which we have already discussed. Let's move on to the next question. What first aid treatment should be taken for acute hydrogen sulfide poisoning? What is the most effective treatment for hydrogen cyanide poisoning? Keep quiet, please. The response given to the patient involves immediate removal of the victim from the source by protected rescuers. Number 2 is placing the patient in fresh and ventilated environment, like providing him a good environment, a good sufficient environment of good air, oxygen, ventilated environment, like putting oxygen mask, etc. Okay. Maximum supportive theory, Kamar already explained about it, and he already explained about nitrates, and he already explained about hyperbaric oxygen, so no need to explain it again. Let's move on to the next question. How to prevent and control the hydrogen cyanide poisoning? Start talking, please. The steps to prevent and control hydrogen H2S hydrogen sulfide poisoning is as follows. Number 1 is to identify the processes that could release or produce hydrogen sulfide. Firstly, to know about this from where it comes. The second thing is to monitor the air for oxygen sulfide. And the third thing is use exhaust and ventilation systems to reduce hydrogen sulfide levels. Number 4 is train and educate the workers who are working in the industry or working there in the about hazards and controls of the hydrogen sulfide. So when there is any emergency or unfortunate situation, so the workers will know about this, how to deal with it. And the fifth thing is to establish proper rescue procedure to safely rescue someone from a hydrogen sulfide exposure, like providing them first aid kits, and some nurses or doctors in the industry or where they are working. So they have, whenever they are getting, there is any unfortunate situation or someone is poisoned with hydrogen sulfide, so he will be quickly rescued. And the sixth thing is to use respiratory and other proposed protective equipment, like, for example, oxygen mask and other things which are personal protective equipment needed with the every worker, or there is any for making a center for the rescue center, so that if anyone gets poisoned by the hydrogen sulfide, so he will be treated on time. And that's all about this. And thank you for your time. And let's watch the video. Please watch it silently. Okay? Any question?